everyone, I'm Cheryl Ann Soriano, a first year BS Nursing student from PLD College INC, and today I will demonstrate Gordon's 11 functional health patterns.
Gordon's functional patterns provide a holistic model for assessment of the family. Because assessment data are classified under 11 headings. It also provides objective data that may indicate future decline or improvement in health status, allowing the nurse to plan and intervene appropriately. Before we start assessing the patient, we just first check his or her chart. Medical charts contain medically relevant events that have happened to a person. A good medical chart will paint a clear picture of the patient. Next is to wash the hand and observe appropriate infection control procedures. Nurses washing their hands not only prevent them from getting sick, but it also reduces the risk of infecting others. If they don't wash their hands properly before coming into contact with others, they can infect their patient but also their family members.
So, good day ma'am, I am Cheryl Ann Soriano and I am nurse practitioner student from PLT College INC, and I will be completing your appointment for today. So I'll just be asking you a few questions about why you're here and a little about your background or history. So if you feel a little uncomfortable answering my question, just let me know, okay? So before we move on, can you please tell me your name and the date of your birth?
I am Marlene Dunan and I was born on September 28, 2000.
Okay, so we're just doing this to ensure that I'm with the right patient, and also you don't have to worry about the information you're going to share with me because it will remain confidential of unless any healthcare person would you want to access information for your care, okay? So the first set of your health assessment, so this is for your health perception. This is to enable a more thorough report that classifies about your patients, about your condition, okay? So the first question is, how would you describe your usual health status?
I am healthy and very active.
Okay. So are you satisfied with your usual health status?
Actually, no, because I'm suffering from back pain.
Okay. Are you use tobacco?
No,
How about alcohol?
no,
How about recreational drugs? Okay. Do you have any history of chronic illnesses?
no,
Okay. Do you take any immunization?
no,
Okay, good. So have you taught any healthcare assistant the past year?
no,
Okay, so I assume that you are studying, right?
yes.
How could you rate your studying conditions?
It's not that stressful, but I am doing it.
Okay, good. So, are you taking medication?
No.
So, how about your living condition at home?
My living condition at home is fine.
Okay, so have you had accident or injury or falls?
Yes.
Okay, so have you had any problems during the healing process of your head cuts?
No.
So, do you exercise in a regular basis?
Yes.
So, what type and how frequent?
Just like a light exercise only, and I usually exercise 3 times a week.
So, do you have any suggestion or request for improving your health?
No.
Okay, so do you do breast examination?
Yes.
How often?
Twice a month.
So, for the next set of question, this is your nutritional or metabolic. So, this is to define your nutritional status and to define determine whether there are relevant malnutrition and to monitor changes in nutritional status. Okay? Do you have any weight gain or loss in the past 6 months?
Yes.
How many?
5 kilos.
So how would you describe your appetite?
I have good appetite, but I have fast metabolism.
Okay. So do you have any food intolerance or restrictions? Okay. Describe and average this food intake for you, including your snacks.
5 times a day.
Okay. Describe average a day fluid intake for you.
8 to 10 glasses a day.
Okay. So describe food likes and dislikes.
I like foods that are salty and spicy, but I don't like foods that are sweet.
Okay. Would you like to gain or lose weight?
Less weight.
So, do you have any problems with nausea, vomiting, swallowing, chewing, or lunch? That's good. So, could you describe your usual lifestyle?
I'm healthy and active.
Okay. Okay, that's good. So, for your elimination pattern, this is to that you have a regular soft bowel movement and adequate urination and to identify different abnormalities. So, what is your usual bowel movement? How frequent?
I'll bowel 2 times a day and I pee 5 times a day.
Any history of constipation? Diarrhea?
No.
Incontinence?
No.
Okay, that's good. So, character of stool. So, what is the color of your stool?
Brown.
Any bleeding?
No.
Okay, so for your usual voiding pattern, how frequently you avoid?
2 times a day.
Are there full control of your void?
Yes.
Okay, so what is the amount of your void?
Normal amount.
Okay. So for activity or exercise pattern, so this can improve your health and reduce the risk of having several diseases. So do you have any breathing problems?
No.
Do you have a cough?
No.
Okay. How do you perceive your own self-care activities?
I really take good care of myself.
So are there any change in your heartbeat as you exercise?
Yes, my heart beats faster when I do exercise.
So are there any change in your heartbeat during exercise?
Yes, my heart beats faster when I'm doing exercise.
Okay, so do you feel pain during exercise?
No.
Okay, what type of exercise do you have?
Light exercise.
So are there any problems?
No.
So how many pillows do you use to sleep?
2 pillows.
Do you experience fatigue?
No.
Do you have occupation?
No, I'm studying.
Describe your usual leisure time activities or hobbies.
I'm just playing basketball.
So any problems with concentration?
No.
Okay, so for the next set of question is this for your sleep rest pattern. So sleep is vital and which is often neglected. So this is a component to every person's overall health and well-being. So what are your usual sleeping habits?
I usually watch live online selling before sleeping.
Okay, so do you have difficulties going to sleep?
No.
So do you wake up in the middle of the night?
Yes, when I need to pee.
Okay. So do you wake up early?
Yes.
Do you have insomnia?
No.
Okay, so do you use any medication to promote sleep?
No.
Okay, so for your cognitive perceptual pattern, so this assessment is focused on the ability to comprehend and use information on the sensory function. Okay, so do you have any hearing difficulties?
None.
How's your vision?
I have a good vision.
So any change in memory lately?
None.
So, important decision, is it easy, difficult?
No, not really.
Do you learn things easy?
Yes.
Are there any discomfort, pain?
Yes, back pain.
Okay. So, what makes your back pain worse?
When I wash my clothes.
So, what does the back pain feel like? Can you rate it from me? From 1
6
to
out
10?
of 10.
Okay. So, when your back pain started,
Every time I wash my clothes.
so for your self-perception and sub-concept pattern, this is to understand what attitudes or emotion you are experiencing internally. So, what is your major concern of the current time?
This pandemic,
Okay, so how would you describe yourself?
I'm feeling better.
So, is there any change in your body?
None.
Is there any change in the way you feel about yourself?
No.
Okay. So, do you believe that you will have any problem?
No.
Okay, what are the things that frequently makes you angry?
During menstruation,
So, fearful or anxious?
whenever I have decision to make.
So, do you feel like losing hope?
Yes.
On a scale 0 to 5, rank your usual assertiveness level.
3.
Okay, so on a scale 0 to 5, now would you rank your level of control?
5.
Okay, so for the next set of questions, it's all about your role and relationship pattern. So, are single, taken, or married?
Single.
So, do you live alone or with your family?
I'm living with my family.
Is it extended or not?
None.
So, any family problems?
None.
So, do you have any losses?
Yes.
Okay, how would you describe your social activities?
I am a jolly person.
So, how would you rate your comfort in social situations?
I am comfortable when I am close to the person around.
Okay. So, are things going well in your studies?
Yes.
What activities do you like and dislike to do?
I like hiking, but I dislike household chores.
Okay. So, for your sexually and reproductive, so if you feel uncomfortable in answering this question, just let me know. So, how is your sexual life?
Good.
Are there any problem?
None.
Do you use contraceptives?
No.
When was your last menstrual period?
Last week.
Do you have menstrual problems?
None.
So, for your coping stress tolerance pattern, so is there any stressful or traumatic event?
No.
Is there anyone available to talk to you?
Yes.
So, how would you rate your usual handling of stress?
I am handling my stress very well.
So, have you used any counseling groups in the past year?
No.
When do you have problems in your life? How do you handle them?
I usually handle it by understanding the both sides.
So, most of the time, is this successful?
Yes.
So, we are now in your last pattern for your values or belief pattern. Are you satisfied with the way your life has been developing?
Yes.
So, will this admission interfere with your plans of the future?
No.
Okay, so what are your plans for the future?
I want to be a nurse also.
What is your religion?
I'm Catholic.
So, does help when difficulties arise?
Yes.
So, are there any religious restrictions?
Yes.
Okay, so are there any other things we haven't talked about that you like to mention?
None.
Okay, so do you have any question or clarification?
None.
Okay, so that could be all, and thank you for your cooperation.
Okay, thank you.
Okay.